Mm-hmm. Dr. Bornhoff, we spoke just prior to starting the recording here about how one healthcare system is not like all others, and so there's maybe some importance to clarify. Can you set the stage in Sweden, in Gothenburg, right there, where this triage system was implemented early on? And what was the behavior or the societal attitude toward musculoskeletal disorders and who patients should see first?
Mm. Well, for one thing, the sort of regulatory base here was very, amenable to working this way, because has not been any referral requirement to physiotherapists for many years here, and there's no cap to the number of physiotherapist visits you're allowed to have. You do not. You don't pay an awful lot. It's all part of the healthcare system. You pay a certain patient fee for every visit, but that's up to a certain level per year, and that's including all doctors' visits, physiotherapist visits. They all go on the same system. So once you come up to a certain sum, then the rest of your visits are free. So it's not a big expense for the patient to go to a physiotherapist. There's nothing preventing you from seeking directly if you need to, but it's still tradition, and most people go to the doctor first and don't always know that, I can go to a physiotherapist directly if I want to, and where am I supposed to do that? And a lot of people will go to the doctor just because that's where they've always gone. When something's wrong, they go to the doctor, and if something more is needed, they expect their doctor to send them on. And if that was the case, that all doctors did this regularly and sent all patients to a physiotherapist, then it wouldn't be a big problem. But since a lot of doctors don't do it, even those who say, I'll go to a physiotherapist, there'll be a lot of patients who don't do it. So in our case, starting with a physiotherapist was a big advantage. And I work in an area with a lot of immigrants, and they come from a lot of countries where there is not, physiotherapists are not a big part of the medical system. You go to the doctor for everything, and that's what people do here in this area.
Mm-hmm. Let's talk about that for just a moment. What do you understand? Perhaps you've looked into it, maybe to a greater degree, maybe not. What are other societies like? Are there countries, are there regions of the world where people do go seek their physio or their physical therapists when they have a shoulder or a neck or back problem versus other places? Is it predominantly similar to Sweden, where most of people would think, let me go see my doctor and they can tell me where I need to go, or is it otherwise?
Oh, I think so. But the doctor is by far most common in all countries. And then the ease of seeing a physiotherapist when you need to it varies. And in a lot of places, it's an extra expense. And a lot of places, maybe you get a certain number of physiotherapist visits per year, as including some kind of insurance, or and then there'll be, of course, countries where physiotherapists are just not very common. They're not available to the general public to any great extent. And so in Sweden, we have it quite easy as physiotherapists. We have, and there are a lot of people who go directly to physiotherapy, but not all of them. As many as we think should.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.